Good morning, good afternoon, good evening, buongiorno, buenos dias, hola, bonjour, and wherever you are, welcome to this WHO and TechNet webinar session on leveraging COVID-19 vaccination lessons for adult immunization. You can listen to this session in English, French, and Spanish. To select the language you want to listen this session to, please click on the globe icon at the bottom of your window and select the language in which you'd like to listen to this session. In addition to interpretation, you can use the subtitles at the bottom of your window. So click on the CC and select the language that is used. Please note that TechNet is not responsible for the accuracy or quality of translation provided by Zoom's automatic caption feature. We'd be happy to know who's with us today, so you can already introduce yourselves in the chat box and tell us your name, where you're from. You can also use the chat box if you need technical support. I'll be here and do my best to help you. If you have any question about the presentation and during the presentation, please use the Q&A box. The Q&A box is available at the bottom of your Zoom window. Ask your questions at any time. Our panelists will answer them in writing when they can, and during the Q&A session after the presentations. Finally, this session is recorded as usually, and we'll share with you probably next week the links to the video as well as the slides by email. I hope you'll enjoy this session, and I'll give the floor to Alba. Alba, the floor is yours.
Thank you so much, Alex. So welcome everyone. Good morning, good afternoon, good evening. Welcome to the TechNet WHO webinar about leveraging COVID vaccination lessons for adult immunization. I'm Dr. Alba Vilageliu. I work at WHO headquarters, Geneva, as part of the EPI team, and specifically as part of the program strengthening team in the immunizations, vaccines, and biologicals department. It's a pleasure to be here today, and we'd like to say that as a context, COVID vaccination allowed many countries to gain massive experience vaccinating adults. More than 13 billion doses were administered since December 2020, when the first vaccine became available, and most of these doses have been to adults. It was a success and the fast delivery in history, and 99 of the countries introduced in 1 year. A lot of the countries, particularly LMICs, gained a lot of experience vaccinating adults. And when I say adults, it means older adults, those with comorbidities, also immunocompromising conditions, pregnant women, and healthcare workers. We want to be able to leverage all this learning to build and strengthen adult immunization platforms for existing vaccines, as is the case for seasonal influenza, COVID, as I said, as well as maternal RSV, recently recommended by SAGE, as well as pneumococcal, zoster vaccines, or other vaccines that are already targeting adult population. We also want to build these platforms for the future, because we know that in the pipeline, there are other vaccines that are going to be life-changing, as it is the new generation of tuberculosis vaccines. And we know that the candidates that are in the pipeline in the clinical trials are targeting adolescents and adults. Also, in terms of pandemic preparedness, in a potential situation of a future pandemic, one of the things that we learned from COVID, the response, is that there is a need for a strong and resilient immunization programs that are able to target groups beyond children, particularly adults, particularly those that are vulnerable and present highest morbidity and mortality. In that context, it's how we started to generate and to launch this webinar series. Today, it's the first webinar, and we're aiming to be able just to continue doing so in the coming months, being able to really showcase best practices from different countries. What we're going to have today, it's the presentation from 3 countries, Bhutan, Kosovo, and Uruguay, and then we're going to have a Q&A session. As my colleague Alex just mentioned, we're going to go through the 3 presentations, and would appreciate that if you have comments or questions, you use the Q&A tool Q&A option, which is at the bottom of the bar of Zoom, to be able to post them while the presenters are presenting their best practices. After that, Daniela, my colleague Daniela, who's the community manager of these webinars, it's going to be able just to moderate the session, to be able to, if you want to raise your hand, intervene and pose the question. So having said that, I would like to introduce the three speakers today. Daniela, do you mind to go to the next slide? First of all, we have the pleasure to have here today with us Dr. Tashi Dawa. He's the Deputy Chief Program Officer, Vaccine Preventable Disease Program at the Department of Public Health in the Ministry of Health of Bhutan. Thank you so much for joining today, Dr. Tashi. Then we're going to have Dr. Edita Hashil, who is the National Program Officer on Immunization at the WHO office in Pristina. And she's going to be presenting the Kosovo experience on behalf of the Ministry of Health. And then finally, we're going to have Dr. Stephen Tapia, who's the director of the Immunization Unit, Ministry of Public Health, and also he's the assistant professor of infectious diseases at the University of the Republic in Uruguay. So thank you so much to the three of them for being here today and being able just to share their experiences in a way to promote that peer learning among different countries. Having said that, I will pass towards Tashi, Dr. Tashi. Thank you so much.
May I? Okay. Good morning, good afternoon, and good evening, everybody. So I will be presenting on some of the best practices and how the successful integration of COVID vaccine and influenza vaccine into our routine immunization program today. So next, please. Can you go to next slide? Okay, this would be my presentation outline. So, but I will be dealing most of the time in the okay, so I think before we really go into my presentation, so I think I need to brief about my country. Bhutan is a very small country, and we have only 20 districts with 205 blocks, and all the health facilities, all the healthcare system in Bhutan are free of services, and there is no private healthcare system in Bhutan. So whatever we are providing, it is the state funding. Next, please. Maybe I'll put off my camera. So just to highlight on this. So basically, this is the in the left side part is the immunization schedule for the childhood, and the right side part is the immunization schedule for the pregnant women and the influenza. So usually we have 2 doses of influenza for 6 to 24 months children, and for rest of the other 4 categories we have a single dose. It is an annual event and seasonal one. Next, please. So initially, Bhutan started this sentinel surveillance on influenza in 2028, and now after the COVID-19 pandemic, it is fully integrated with the COVID integrated flu surveillance system. And also, we had conducted a study in 2017, and based on these two, so our NITEC had recommended the target group for influenza vaccination in 2019, and the influenza vaccine in Bhutan was started in 2019. So high risk group are 5 categories, like children 6 months to less than 24 months. This is a 2-dose regime, 1 month apart, and pregnant women, health workers, elderly population above 65 years, and earlier it was started with the 60 years part. Now, based on the change in definitions of the elderly population, now we have shifted to 65 years and above. And people with existing comorbidities, especially like transplant cases, immunosuppressions, then heart diseases, then currently taking medicines on diabetics, and such things, such people, comorbidities are included in our high risk group. Next, please. So some of the, we are saying that we have successfully integrated our not only influenza vaccine, but also COVID and HPV, and all the vaccines are integrated into the primary healthcare system. So some of the successful enabling factors for the successful integrations are like, we have around 184 primary healthcare facilities with 54 hospitals, where all primary health, all the health systems are integrated with the primary health care, and along with that, EPA program is one of the program which has already been integrated since its inception in 1979. So with that, and also we have a very strong leadership and political commitment, and along with that, so although we may have capable health workers, then all infrastructures are ready, but if you do not have a cold chain equipment, then it may be very difficult to provide potency of vaccines to our target population. So we do have about almost 90% in above cold chain equipment are WHO pre-qualified. This is supported by, especially during the COVID pandemic. So we have enhanced a lot on this. And also we have a financial commitment. So we have a Bhutan Health Trust Fund, which is like an NGO organization under the mandate of Ministry of Health. This is the program where it's not a program, but it's like organization where they will generate the fund and put into the government coffer, and they will keep there, and all the vaccines and essential medicines are purchased through this. So with that, I think we are having good commitment of the not only vaccines but also the essential medicines that we are giving free to our general population. So next, please. So here, I would like to stress more on first and the last point. So every month in Bhutan, October is observed as an elderly month. So we are taking advantage of that, and we are giving influenza vaccines during the month of 1st October, starting from 1st October to 30th October, but they can get even after October, but we are focusing more on this because during that time, or almost all the elderly people will come to nearest health facility, and they will be screened for other non-communicable diseases like diabetes, walking difficulty, then any type of difficulties they will be screened for as per the standard format, and they will come happily to get influenza vaccines. This is a win-win situation, and with that, I think we are having very good coverage especially for elderly population. So most of the time we are getting more than 90% for elderly population. So this is done. Number one, if our elderly people are in the nearby, they will come to health facility. Otherwise, they will come to the nearest outreach clinic. We have a monthly clinic, but during the elderly month, our health assistants will visit to that clinic, and they will provide the influenza vaccine and along with the elderly screening. And at times, then after the end of the month, maybe by last week of October or first week of November, our health people will visit to individual household, especially those who are too old and cannot work, or if there is some disability or differently able people that cannot reach to outreach clinic or health facility, they have to do a mop-up session, and they will go and visit to the respective household, so that we ensure that all the elderly are taken care, and people with disability or otherly differently able people are taken care of that, and including all other risk factors like they can get anywhere, even the health influenza vaccine from health facility outreach as well. But it is not giving for who are young adult and who can work. We are giving to the health facility and clinic. And for TD, we have a school base and we have very high achievable, but I don't want to focus more on this. And for HPV vaccines, we are giving 2 doses to both boys and girls with around 6 months of interval. And for out of school children, we are giving in institution based, especially at hospitals, health facilities, and also in especially in monastic institutions, especially the nunneries and the other monastic institutions. So for hepatitis B, we are giving for the high risk and high risk groups such as health workers and with disease condition as per the schedule. And for pregnant women, TD is given to pregnant women at least twice in a single pregnancy, and it is as per the schedule. They will be given at health facility as well as in the outreach clinic. Now, finally, to the COVID-19 vaccine. So we do have COVID-19 vaccine in the stock, and we are continuously giving. So it is about 6 months gap for especially for comorbid, elderly, and health workers, and even the pregnant women. That is a health facility based. They can visit any time of the year. They will get it because we have a cold chain supply, cold chain equipment which can hold the COVID vaccine, especially the Moderna and Pfizer. We are our people are preparing that, and the coverage is I think it's good enough to say that we have more than 70% for all categories which wherever we require. But now the primary now especially the primary receiver is now not coming much, because the young children, they do not want to get much of the vaccine, maybe because of vaccine fatigue. Okay, next please. So this is just to say that these are some of the vaccination coverage for in the left hand side. Vaccination coverage other than the routine vaccines like influenza in general, we have 90%. Then HPV for both boys and girls above 98%, and also we have a TD2 plus for pregnant women, which is about 99.6%. And compared to I actually I wanted to compare with the childhood vaccination, and there is no much difference of coverage. So it looks like the vaccination coverage are almost similar, and the uptake of vaccine is very good, maybe because of the above mentioned enabling factors. Next please. So now one of the main factors that we are getting good coverage, maybe because of community engagement, no? So information sharing in demand generation. So we are doing multiple community engagement through main media, social media as follows. For example, like we have a Bhutan broadcasting service television in all that time. So we are requesting them to announce at least once in once almost alternate days for the in the month of October. And also we have a ministry official Facebook where we can provide the where we can send a message through written message, verbal message, and all through our ministry Facebook. And also as a program officer, individual has to go to the TikTok show. So we have a TikTok manager in the Ministry of Health through Health Promotion Division. So through that, if there is any question, any doubt, so we can go and talk in the go live, and then we can discuss the importance of influenza and COVID vaccine, including childhood vaccine and the adolescent vaccines. So next, please. So now, how do we register? Do we do registration and data collection? So all individuals, all the high-risk individuals, they can register in Bhutan vaccine system, which was developed in country during the COVID pandemic. So they can punch any of the identity form that they have. Maybe like for pregnant women, they will be using maternal child health handbook register number, citizenship ID card number, route permit. They can enter there, and once they are entered, then our health worker can view that. Once they get the vaccine, then they can directly update in the system. Along with that, we have COVID vaccine, COVID vaccine, influenza, and HPV are in this system. So we are planning to still further enhance and upgrade this. So we do have even to look at the online system to if there is any AEFI cases because of these 3 vaccines, so we can monitor in the system. So these are some of the systems that we have developed. So next, please. So I think this is my last slide. So some of the key issues and challenges. So especially in regards to influenza vaccine, which the timely delivery of vaccine is very important. So most of the time we get delivered by October or November, and then our people they must be already caught with the influenza, and they do not want to get vaccinated. So that's why it's one of the most important. And till last year and before last year, we had some problem in getting on time, but this year fortunately we received by September first week, and now in Bhutan the HPV influenza vaccination is in full swing. So we will be giving till end of October, but still they can get. But we are encourage all the people to come by end of this month. And data entry into the Bhutan vaccine system also has become some of the challenges, because sometimes our internet facilities are not good, although they can do in offline, but still there exists some problem. And although we have a very strong commitment from the government and political leaders saying that the sustainability of financing is they have a very good support system, still because of many other priority list of activity, especially the influenza, the cost of influenza vaccine is very high. Out of around 100% from 100%, about 60% of the budget is spending on the influenza vaccine. So sometimes it is very difficult and challenging for the program to give good justification on continue procuring of the influenza vaccine. Otherwise, I think rest all are going good as per the plan. So with this, I would like to thank you very much and thank you for the opportunity.
Thank you so much, Dr. Tashi. It has been great just to learn how you're approaching the co-administration of influenza and COVID vaccine, and also tetanus diphtheria containing vaccine for pregnant women. And the fact, just to my main takeaway is like how you are just really engaging through different ways, including TikTok, to be able to reach similar coverage of around 90% for children as well as for adults. So congratulations of that achievement. With that, we're going to pass towards the Dr. Edita, who's going to present the experience from Kosovo. Thank you.
Hello, everyone. I'm very glad to present you the COVID experience and the lessons learned and using it for the further implementation and strengthening the immunization program on adult immunization. Alba just presented me. I'm Dr. Edita Agiu. I will present you from my experience, further experience as a former EPI manager at IPH for 3 years, since 2019, 2022. So I've been head of committee for COVID vaccine implementation, and then I moved to WHO at SMPO immunization to support immunization program from the other perspective. So here you can see some demographic data. So in Kosovo, there are around 1.7 million inhabitants with 33 municipalities and 7 regions. So the average population age is 30.2. And on the left, you can see how the health services are organized. So from Ministry of Health, National Institute of Public Health, University Clinic, and the primary health care level in 38 municipality with 258 family medicine center where the vaccination services are organized. Next slide. First of all, I want to present how the immunization program is organized. So the main stakeholders on implementation of immunization program is Institute of Public Health and the Ministry of Health. All of the products, all vaccines are registered in Kosovo Agency Medical Product and needs to be should be from EU countries or WHO pre-qualified. Vaccination plan developed by Institute of Public Health, and the distribution and administration monitoring of influenza vaccine and the other adult vaccine is performed by National Immunization Program and the Institute of Public Health, and monitoring and implementation in the regions are responsible Institute of Public Health in 6 regions. Head of immunization center is the person that is responsible for implementation of this program. The immunization services are settled on each vaccination center in primary health care institutions. In the fixed side, they serve the vaccine, influenza vaccine, on each municipality, and everyone have access to have the influenza vaccine on the institutions. But in the other side, we have a mobile team that serve immunization services on door by door, and also for the person that are with health conditions that need the service at home, the mobile team go home by home and vaccinate them by the list, by the request of their families. And also the mobile team go in places and home centers when the elderly are living, or the other centers that it's needed to go in a daily basis during the vaccination campaign from the beginning of autumn. So this is the services that given on influenza vaccine. Next slide. The flu vaccine is offered for free in Kosovo, and first of all, it's available for a high-risk group that is recommended by SAG recommendations. So Kosovo, first of all, vaccinate a risk group of people over 65, healthcare workers, people with health condition, children under 5, and a pregnant woman. Also, the NITAG and IPH recommendation is that they give the COVID vaccine together with flu vaccine. So in the beginning of the season, on September, before autumn and winter season, there have been produced the recommendation and that they can take COVID vaccine together with influenza vaccine in each vaccination center. So we have also the campaign, ongoing campaign right now in Kosovo, and we used to do in each year before. Key to reduce health economic burden of influenza, prevent disease and death in the population, very rare side effects, and vaccination against flu, reduce cost and spending on health system. So these are the main messages that went through the IPH and the Ministry of Health. Next slide. So sorry, before the one slide, this is the slide. Thank you. Regarding the Kosovo experience on COVID-19 and the vaccine capability of the system and contribution on immunization program, we had a great development since 2021 during COVID campaign till now. So there were 3 different perspectives that we worked on. First of all, on legislation, then operational and strategic. Legislation endorsed, on legislation, we endorsed the law on infection disease where COVID and influenza vaccine have been integrated. Regarding the law on immunization, we updated lately the administrative instruction on immunization where also COVID and influenza vaccine have been integrated. And also we developed few SOPs where we included also the adult vaccination, especially COVID and influenza vaccine, because the IFE report lately introduced and implemented in a digitalized module on health information system. Also, we developed SOP on vaccine flow and SOP on vaccine arrival and distribution for vaccine safety. On operational, we digitalized the vaccination module during COVID, and after that we used the same module to implement influenza vaccine. So in 2022 we had the module also on influenza vaccine in the health information system. And we use the same reporting form and the same page to report the coverage on influenza vaccine based on risk, high-risk group. And also during COVID and afterward, we renew cold chain equipment, and also we have now the vehicles that we distribute vaccine on safe way in each municipality. So the routine immunization vaccines, COVID vaccines, and influenza. On influenza vaccine, we do the distribution once a month from the beginning of influenza season, where the vaccine is available in Kosovo. So usually we have the vaccines on the end of September or beginning of October, before the flu season. Also, we work hard on communication, and we usually, before the season, we produce the material on information population regarding the flu vaccine and the COVID vaccine before the COVID vaccine arrive. And also last year, we organized a caravan where in each municipality, the caravan was for 1 day, and we vaccinate population in that area with COVID and influenza vaccine, and lots of materials have been distributed. So it had really a good impact on implementation of two vaccine in the same time. Also, we produced materials, education materials for students, for healthcare workers, and for patients. And we use European Immunization Week on to pronounce and to present the importance of vaccine, and that the vaccine will be available during the influenza season. And also on strategic approach, we drafted action plan for immunization 2022-2026, where influenza vaccine have been integrated, and everything planned during the year that the activity that we implement during the year is presented in that plan regarding the COVID and influenza vaccine. Also, we drafted a strategic plan for catch-up activities, where we have all activities that we arrange during the year, also training and the other activities that we plan on the catch-up activities. Also, we established NITAC 2023, and the decision regarding the flu vaccine and COVID vaccine always recommended from NITAC and then approved from the Ministry of Health. Also, we invest a lot on strengthening the workforce, on developing the training modules and training materials. Next slide. So, the slide before, sorry. So this is, I'm going to present how the monitoring module looks like on monitoring on IFE reporting form on electrical, on immunization module, and also the implementation of pharmaceutical stock management system to enable the planning and the stock for the vaccine during the season. So influenza vaccine have been integrated last year also in pharmaceutical stock. So next slide. In this screenshot, you can see how it looks like. So the module on all immunization programs. So you can see the routine immunization. First one on the left, you can see COVID vaccine, then routine immunization and influenza vaccine. So COVID vaccine and influenza vaccine are integrated on a immunization module and enable us to have a clear view and exact data on coverage on COVID vaccine lately. So from the implementation of module, we are really comfortable with the data on the coverage regarding the risk group. Next slide. So here you can see virological surveillance on influenza in countries. So as you can see on the left, the second slide, the situation, the surveillance on flu and the epidemiological situation during the COVID. You can see the yellow line 2020, 2021 that we had really a low number of influenza cases regarding the measure that's been on that time. And after that, 2021, 2022, we had a large number of cases, and we tried to continue our support on influenza vaccine implementation, and also supporting healthcare workers on vaccination among healthcare workers, and also in pregnant women and the other high-risk group. Next slide.
Edita, sorry
yeah.
to interrupt you. We will need to wrap up. We're a little bit behind. Thank you very much. Sorry
so
about
there
that.
are some. I have just one slide. So you in the beginning of season, we have this meeting with around 100 healthcare workers with each team on all municipality. Next slide. So here you can see the topics, 4 topics that we work on success and to reach our goal on immunization: on normative guidance, capacity building, awareness raising, and monitoring and evaluation. And the next slide, you just can see the activities on field. So on some photos, you can see the posters on influenza vaccine that we produce in the beginning of season usually, and the leaflets, and also you can see some pics from Caravan last year, training on module, digitalized module, and meetings with working groups on development of the materials on influenza vaccine. Thank you very much. And
Thank you very much, Dr. Edita. It was fantastic to see, and I want to highlight a couple of things. The fact that the influenza vaccine is already included in the plan, the action plan on immunization 2022-2026. So that long-term plan in terms of concerning sustainability, and also the fact that vaccines for adults are one more vaccine, like for COVID, influenza as part of the electronic registry, and that's part of the immunization system. So well done with all your achievements. Thank you so much for being here today. So over to Dr. Tapia to tell us about the experience in Uruguay. Thank you.
Thank you very much, Alba. And well, good morning, good evening for all who are connected today in this event. As Alba introduced me at the beginning, my name is Steven Tapia. I'm the Director of Immunization Program in the Ministry of Health of Uruguay, and I'm going to share the National Adult Vaccination Strategies experience, especially focused on RSV prevention. Next, please. This is the main of the context of the presentation. Next, please. So for making an introduction, Uruguay's national vaccination program was established by national law in 1982. By 2024, the national vaccination plan includes 15 funded vaccines for a vaccine preventable diseases strategy. Vaccination in Uruguay is free and it's compulsory nationwide, available in both public and private health facilities, which is one of the strengths of our program. And as a priority for the Ministry of Public Health, vaccination coverage is a performance goal for public policies, but also for all healthcare providers under National Integrated Health System, serving as a quality indicator in child health programs. Next, please. In this slide, I want to summarize how does the National Immunization Program structure is integrated the role of the Ministry of Health in planning and regulation, vaccination registry policies, vaccination coverage and surveillance. We got an effector, that's an honorary commission for tuberculosis and preventable diseases control that in this case is in charge of storage and cold chain management, distribution and supervision of vaccination center. Here in Uruguay, there's a specific career for immunization. We got immunizations officers career. So everybody that has been trained in immunization is the only one that's ability to provide immunizations in vaccination centers that in this case are in charge of vaccinating people and also detecting adverse events following immunizations. And we also get collaborations or NITAG, adult groups and academic reference and external consultants according to the situation it involves the National Immunization Plan. Next, please. We also get, we also get 279 vaccination centers available all across the country. Vaccination services are available for both public and private centers. Anybody can get in any vaccination center. We also got regular scheme centers for MVP vaccines, mobile vaccination centers, and specific vaccination centers, as we are going to see, because Uruguayans MVP is programmed for vaccines through all life cycle. Next, please. Well, these are in this slide. We can see which are the adult vaccination milestones of the immunization plan. The API was created in 1982, and since then, some changes were specifically made for adult vaccination, including a yellow fever vaccine for travelers in 2001, influenza and pneumococcal 23-valent vaccine in 2004, the introduction of HPV-4 in 2013, and the TDAP vaccine for pregnant women and premature newborn caregivers in 2015. And in 2021 and 2023, COVID vaccine was included and recommended for specific groups, general population and specific groups. And in 2022, HPV indication for adults until 26 years old. And in 2024, the introduction of RSV vaccine in pregnant women from 32 until 36 weeks of gestation for preventing RSV infection in newborns. Next, please. So the MVP of Uruguay has divided vaccines according to the age cycles, children from 0 to 5 years, and in teenagers from 12 to 17 years, and for adults from 18 to 64 years, in pregnant women, and in elderly people. Next, please. In this is our vaccination schedule. It's in Spanish, but it divides it's in all the vaccines through age cycles. Next, please. And we also got a medical condition schedule. Sorry, the first one. Oh, thank you very much. We got a specific condition vaccine recommendations for pregnancy health workers, asplenic people, immunocompromised related to HIV according to CD4 count, medical condition including diabetes, pulmonary disease, chronic hepatic disease, and chronic end-stage renal disease. Next, please. And in our experience with TDAP vaccination coverage nationwide, as we can see, this is implementation from the strategy from vaccinating women from 28 to 36 weeks of gestation. So our coverage rates are over 70% since 2018 until 2023. Next, please. And we also use our electronic immunization registry for thank you. I don't know what's happening, but it's skipping from the last one and this.
Sorry, I don't know what's happening. He's skipping, he's jumping directly to this slide. I will try to stay on next, but it's automatically skipping to this vaccination strategy.
What I was trying to mention on this slide is that we got an electronic immunization registry that allows us to have real data of vaccines coverage through all territory. This was implemented in 2017, and since then it has been one of the best keys we got for monitoring coverage in adults. One of the lessons we have from COVID-19 vaccination strategy is that we needed to have a specific planification and logistic for adult vaccination. As we know, in all EPI plans, children vaccines account more than 80% of the load on planification. And this, in COVID-19, it was specifically at the first of the pandemics. The vaccination strategy involved specifically elderly people and adults over 18 years old. As we know, all the vaccines for teenagers and children were in development. So we need to have a specific planification for this. We also need to see cold chain supplies renovation. And one of the strategies Uruguay applied was creating vaccination hubs and referral centers for special conditions. We also need to provide continuous medical education for vaccination officers, and also have real-time vaccination coverage data for decision-making, as we're going to see in the next slide, and also improving our adverse events surveillance information. Thank you. And with these tools or information system, we can check the coverage for COVID vaccines in real time. In this slide, can you put next, please? This is a part of the RSV prevention strategy for 2024. We have a late introduction of RSV vaccine because of its availability. But we also gave a COVID vaccine, influenza, and TDAP vaccination in pregnancy. So we got a plan that included all these vaccines. Next, please. We made a regional study for its implementation, understanding the RSV disease burden. In Uruguay, it's one of the most southern countries in Latin America. So the data shows that RSV is one of the major causes of severe acute lower respiratory infections. 90% of the bed occupancy during the winter is by pediatric respiratory disease. And that's made that important for making a targeted population decision, specifically for infants at higher risk, and understanding that it has economic benefits. So it's related to high economic costs for preventing lower infections in children. Next, please.
Tapia, sorry for interrupting. We will need to wrap up soon. Thank you. Sorry about that.
Don't worry. This is one of the timeline of RSV implementation. Next, please. And the results of the public communication campaign we made for promoting vaccine. Next, please. And for 2025 of the introduction, a part of the vaccine, the passive immunization through nirsevimab. Next, please. And the preliminary results of this part of the campaign is that we had 1,638 pregnant people vaccinated with a coverage of 58.5% in Uruguay. We had no serious adverse events related to vaccination and no neonatal adverse events were averted from health providers. Next, please. Next, please. It was important to know that we need to make an assessment to all health providers because they play a crucial health role in influencing RSV immunization strategy. But also we got to promote communication strategies and information access to specific population, specifically focused on pregnant women consultation and counseling, family information, and workshop for RSV prevention among press agents. Next, please. And I think it's one of the last slides, where these are some of the challenges specifically related to the surveillance of adverse events and improving the vaccine acceptance in the next campaign for 2025. Next, please. And I'm quite sure this is the last slide. These are some of the conclusions. Uruguay MVP promotes vaccination through all life stages. The COVID impact made us notice the importance of having real-time data for public trust and healthcare decisions. These are the primary results of our RSV campaign. And well, we plan for the next years to improve some parts of the strategy, specifically related to pharmacovigilance protocol and border vaccine coverage. And I want to thank you all for your attention. This is our contact. And well, I don't know if there are any questions, and I'll be happy to answer if there are. Thank you very much.
Thank you so much, Dr. Tapia. It was brilliant. It was really inspiring. And I want to highlight a couple of things also. I mean, the fact that the first year that you implemented maternal RSV, you were able to reach out more than 58% of pregnant women. Congratulations from that achievement, and also just for being ahead of the curve, because SAGE just at the end of September recommended to introduce, for the countries to continue to introduce maternal RSV and or the monoclonal antibody for infants with the aim to prevent the burden of respiratory syncytial virus in infants. So well done on that end. And also the fact that you have a super clear immunization schedule with tables that are super visual for all ages, understanding that vaccines are for all, not only for children. So with that, I'm going to pass to my colleague Daniela for the Q&A session.
Yes, we have Q&A session in the chat, and I can start with the first question that I'm gonna see. The first one was about, I'm reading this one. During the COVID-19 pandemic lockdowns, have you used web-based learning for the healthcare workers, and how you find it? This is a question from Arshad. Any of the panelists would like to answer about their experience with web-based learning for healthcare workers?
I believe this was a question that was done during Dr. Tashi's presentation. So maybe Dr. Tashi, would you like to address that?
So I don't know whether I heard the right question or not. I was just thinking that, how do we engage our health workers through online learning during the COVID pandemic? Am I right?
Yes, you are.
Okay. Now, Bhutan being a very small country, and also in most of the areas, especially till at the block level, we have a internet connectivity. That was the biggest advantage that we had. And also in most of the primary healthcare centers, say around more than 80%, we have a internet connectivity. So with that, initially we have started with the introduction of COVID vaccination, how to go about it, including from the strategic. So how to process, how to go about. So we start that, and also that was actually a new vaccine for us, and especially we do not had enough cold chain equipment during the early phase, and also there was no vaccine as well. But still then we tried to negotiate ourselves. So there were a lot of internet connectivity. So we make a group each other. So there was a NITEC member at a technical advisory group at the top level. Then it comes to sub-national technical advisory group at the district and the sub-district level. Then each group was taken care of by the district health officers and district chief medical officers at the district level. With that, I think we had a vigorous exercise on that, and now we are confident that we have an existing system in place. Now people are now used to with the online system. Now we are learning most of the time through online. However, it is always better to have face-to-face, but still then with a very poor in the resource constrained country, I think this has helped us a lot. And similarly, but the basic thing what we need is we need to have a very good connectivity, internet connection. So like today, I'm having very difficult. I'm in one of the block which is in the center of Bhutan. So I don't know whether I have answered it or not. That's from my side. Thank you.
Many thanks. Many thank you for your answer. I see two hands raised, and Arshad Chandio was the one who raised this question. Would you like to say something? Would you like to say something? Over to you. Otherwise, we can pass to the next question in Q&A. I'm projecting on the screen and reading. I would like to know the strategy for reaching out to the population out of school for immunization in Bhutan. That's again for Dr. Tashi. Is there any specific system or regulation to identify those population? Also, immunization is okay. Dr. Tashi, would you like to add something and address this question?
Okay. Yeah, in Bhutan, so as a human right, there is not a compulsory, but we insist them through regular and vigorous communication and in the advocating that the importance of vaccination is important, not only for individual but for the community as a whole. And also now we have achieved a lot of certification like polio free, rubella and measles eliminated, MNT eliminated, maternal and neonatal tetanus eliminated, hepatitis B under control. So we have achieved a lot. So what we are saying is, so it is not compulsory to get vaccinated, but if there is any outbreak related to your children or yourself because of you, so you will be held accountable. So we do not have a regulatory saying that it's compulsory, but the best part for Bhutan is we do not have anti-vaccine lobby. For now, we are achieving because there is no people saying that vaccine is not good for health. But we are not sure. Maybe by some ignorance, sometimes we may get such type of things. But for now, we are not having any so we are saying it's not compulsory, but you have to get it. But as per our constitution or any law, it doesn't say that you have to get compulsory. But during the admission in the children, when they go for the child admission in the school, they will check the immunization status and they will advise us once again to go and get vaccinated. But we should not ignore the admission of the child. Thank you.
Thank you so much, Dr. Tashi. I also see a remark from the same person. Also, immunization is compulsory in Uruguay. So what are the consequences if someone does not want to get immunization? Dr. Tapia, would you like to address this question?
Yes, thank you very much for the question. Yeah, as it's compulsory, there are some ways to control it. For example, everybody that is formally working needs to have a healthcare certificate of being able to work. So it's one of the controls. If someone is not vaccinated, this certificate cannot be given. So people must get their vaccines updated. In the case of children, there is no sanction or there is no penalty for people who parents who doesn't vaccinate children, but there are some ways of control. There are this is one of the main strategies it was implemented. And in some cases, for example, for certain groups that are against vaccines, in this case, in Uruguay, may constitute children's health rights vulneration. So they are directed to the justice in order to make parents vaccine children. I don't know if it was clear. my answer, I can write it down on the chat if it's better.
Or you can use the community of practice forum. That would be very helpful. So we kickstart the forum. Can we go for another hand, which was raised? Arshad. Arshad, would you like to ask your question? Or maybe Arshad is not available. So
Yeah,
Arshad, you
can
can
you
unmute.
hear me? Can you hear me?
yes, we can.
Can you hear me now? Okay, thank you. Thank you, Martini, and thank to the panelists and the presenters. Those were wonderful presentations from Bhutan, Kosovo, and Uruguay. And we were able to learn that how they transformed themselves during the COVID times, and they make progress in immunizing their population. But what I understand, these are like small countries with very, very small countries, and having those immunizations, COVID immunization done at easy steps for them to immunize their population. But in countries like Pakistan, from where I belong to, is like more than 240 million people or population of this country is. So actually, what I posed a question earlier as well, and my questions are on learnings of the COVID-19 would be some different. Like what we have learned in our country was how to use or how to shift from classroom trainings to the digital learnings for our human resource. That was one of the achievement of most of the countries who have been dealing with COVID-19 and big countries. So we shifted from the classroom to learning to digital learning. But the problem is that today we are discussing about the COVID lesson learned and how we can implement in the future. So I think those digital learning platforms are fading out, and we are now again moving back to the classroom learnings to deal with any other pandemic, God forbid. But we have to continue or learn from what we have learned during the COVID to train our human resource digitally or through web-based learning. Another thing,
Sorry, Chad, I'm afraid that we are over time, and your contributions are really appreciated, and we can continue them. And Daniela, it's gonna, because as part of this is just the webinar series, but we're also launching the community practice in TechNet about adult immunization. And as part of that, there is a section that is about a forum where we aim to really for countries and for different stakeholders to be able just to put questions there, and for other countries or other people knowledgeable on immunization on how to be able to address or what are their lessons and so on. So Daniela is projecting about it. We're gonna put the link in the chat. And with that, we are gonna invite you just to join our next webinar session that is going to be in a month. We'll figure out and send all the details in the coming days, as well as we'll send the materials of today's session, which is going to include a slide deck, as well as the link on how to join this community of practice. And with that, I would like to thank everyone for contributing to this conversation about how the existing adult immunization and how the potential for future vaccines is going to be. And also, especially to the panelists today and the three countries for sharing their learnings and also their challenges and how they are progressing on that topic. Thank you so much for joining this conversation. Looking forward to the next one. Have a nice day.
Thank you so much, everybody. Please join the community practice. You need first to register in TechNet before joining the COP on adult immunization, but you will receive all the steps by email.
Thank you. Bye, everyone.